Hello, good afternoon. This is Dr. Reddy from Seven Oaks Pet Hospital, Wesley Chapel, Florida. And thank you all for joining. I'm going to talk about leptospirosis infection in dogs. Leptospirosis is a bacterial infection which causes a devastating disease in dogs, sometimes in cats too, but most of the time it is seen in dogs. And not many people know that leptospirosis infection can be prevented and protected. Dogs can be protected by vaccination. And the vaccine is been available for a long time. It's recommended by AVMA as a non-core vaccine. Lately, we've been seeing a lot more leptospirosis infections in dogs as compared to previously 15 years, 10 years back. We used to think leptospirosis is caused mostly in farm animals or dogs which are living outside, but now with everything else going on, leptospirosis has been noticed even in urban dogs which live in regular communities in the suburbs or in the cities. So let's talk about this bacterial infection. How does dogs get the leptospirosis? Dogs can get the leptospirosis if they're in contact with rats, raccoons, or any exotic squirrels or rabbits or anything which are exotic species. And they get infection if they come across any infected urine, infected feces, and if the dogs have any cuts or abrasions or anything on them, and that's how the bacteria enters into the dogs, and then the disease, they start getting this leptospirosis. And once that bacteria enters, it goes into the kidneys, are the number one organs. The dog starts getting infection, and what they do is they start peeing in the house, having accidents. So owners assume that it could be just a bladder infection. Dog is peeing, and as soon as the dog pees, first thing what we do is we take a paper towel and start wiping the pee with our bare hands. And because we don't think of anything else but just thinking it's a UTI. And that is the worst thing we can do for ourselves, because we have to remember here, not only dogs are infected, it can be infected to people. So this leptospirosis has a zoonotic infection happening, it transmits from dogs to people. So at that point, we should assume if your dog is not vaccinated for lepto, it could be lepto. So always try to wear some gloves to clean the dog pee, so that if you have any cuts or abrasions on your skin, and if your dog is infected with lepto, that urine can get into your system and you can get infected with lepto too. So it's better to be safe than sorry. So that's why it's always recommended to clean the urine with wearing some gloves or so. It's hygienic too at the same time. So that's one thing when we're talking about dogs to human transmission. But also the other things with leptospirosis is the good thing is obviously it has vaccine and it can be treatable. 80 to 90% of the dogs can get treated and then can be back to normal. But if it's not diagnosed the right time and right way, dogs can die actually with leptospirosis, causing liver failures and kidney failures. So it's always good to vaccinate them. Talk to your local veterinarian and the doctor to get you the recommendation if you really think that if your dog is going to get exposed to those leptospirosis or there's a chance, it's better to get that vaccines. And vaccines start as early as 8 to 10 weeks of age, and then we do the booster after 3 to 4 weeks, and then they should be get protected for a year, and then after that, once a year, if you do the leptospirosis vaccine, they will be 100% protected. Like I said, it's not recommended for every dog, but it is definitely recommended if we presume that there is a chance of being exposed. Because not only we are protecting the dog here, we are protecting the human health as well, because leptospirosis has a zoonotic potential. And At Seven Oaks Pet Hospital, if you're suspecting leptospirosis, we do have an in-house testing capability, so we can do a quick snap test and then can give you results pretty quickly in 30 minutes or so. And also we have a capability, we can run a PCR test on leptospirosis to give you 100% diagnosis as well. So those are all important things on the leptospirosis, what we are talking today. Hi, Ms. Clark, thank you for joining. We missed you last time, but thank you this time for joining. And the other things about leptospirosis are, as I said, it's a bacterial infection. It can be treated, and it has a potential to be zoonotic. Sometimes there are some reports in cats also we have found leptospirosis. I've never diagnosed a cat with leptospirosis personally, but there are some reports, anecdotal reports, saying that cats can have cats can have leptospirosis. But dogs, yes, we have diagnosed here. And probably a few years ago, there was an outbreak in the area. Not going to name the name of the hospital, but there was a local hospital which had a leptospirosis case in the hospital. And unfortunately, by the time the dog came positive, or by the time all the doctors or technicians at that hospital came to know about the disease, or know about the dog was positive, most of them were exposed. So luckily nothing bad happened, but that hospital was quarantined for a few days and then back to business. But what I'm trying to say is leptospirosis is something which we have to take it very seriously in dogs, especially because it causes transmission to humans, and humans get it from dogs if they have an exposure. A dog has an infected urine and human has a skin abrasion or skin cut on the body, and sometimes it goes through their mucous membranes too. It's better to, if you know for sure the dog is positive, it's always better to wear some goggles and gloves to walk around or work around the dog, or clean up the dog, or take care of that infected dog. And like I said, if we find them positive, we can start treating them with antibiotics, special antibiotics called doxycycline. We can try them, and within 24 hours, the bacteria it dies from the blood, but still can be in the kidneys and the urine for at least 4 or 5 days, and after that, they do leave the system of the body of the dog. And then disinfecting the area or the house if you think that the dog has leptospirosis. The good news is, you can just use a regular bleach solutions to wipe down or clean down the house, or the kennel area where the dog is being sleeping or spending most of its time. And this bacteria dies pretty quickly with regular bleach. If you don't kill, or if, let's say, if you have an infected dog and the dog peed or pooped somewhere outside, that bacteria you'll be surprised, can stay out in this weather. In the warm weather, this bacteria thrives. Actually, I forgot to mention that. And in this warm weather, that bacteria can survive for up to 30 days is what people have said it could live. So if an infected dog peed or pooped somewhere, and then you happen to walk your dog in that area in that period of time, your dog can get infected from the leptospirosis. So that's how that bacteria stays in there. And a lot of times this bacteria stays in the stagnant waters and ponds or lakes if there's an infected dog, and as I said, raccoons have that, rats have those things in their system too, so they can carry that, and if by chance the dog happens to pass that area, or humans too, they can get infected by the leptospirosis. So those are the different things I can think of about leptospirosis at this point. I don't know if there's any other things I need to cover about leptospirosis, but like I said, leptospirosis has a vaccine, and it's treatable. So those are all the good things. And incubation period, probably anywhere from 5 to 14 days is what we see in the dogs. And after that, the medication or the treatment takes over, and then they're not infected anymore, or they're not in that stage of infecting. And dogs get from humans, but there's no report of transmission of leptospirosis from humans to humans, I think, if I know correctly. Again, I'm not a human doctor, but yeah, that's what I think. What dogs do get from, the dogs do transmit to humans is for sure, And I think that's all about the lepto. It's pretty. There's not a whole lot to talk about lepto other than medically we can talk all other conditions it happens, but I don't think that's going to be a huge information which would change anything for you guys out there. But I wanted to talk about the transmission, talk about the vaccination, talk about how this survives in the environment and how we can kill that bacteria out there with regular bleach like Clorox or something. So those are the important things I wanted to cover. All right, so I think that's all about leptospirosis. But as I said, we have a vaccine, so please check with your veterinarians and see if they're offering the vaccine and if it's good fit for your lifestyle and for your dog. Otherwise, thank you all guys for watching this, and I would be back again next Thursday at noon, same time. All right, thank you, and have a great day. Bye bye.